Okay. The immunoglobulins are our antibodies. So these are the antibodies. IgG accounts for most of our antibodies. And these are just circulating in the blood um, from previous infections. They account for 80% of the circulating antibodies. The IgGs are passed from mother to fetus through the placenta, and they give the fetus about 6 months of protection after they're born. So once that new baby's born, it'll have about 6 months of protection from the mom's antibodies. And 6 months is right around the time the baby's immune system is kicking in anyway. IgA, 13%. IgA we find in exocrine secretions. So, tears, secretions in the intestine, breast milk. And so this is another way through the breast milk that newborns can get protection from the mom. IgM accounts for about 6%. IgM are the first antibodies produced during an infection. So these are the first ones produced, and they're larger than the IgGs. IgDs, these are the ones, less than 1%, these are the ones that are actually on the B cell. So those are actually on the B cell, attached to it. And then IgEs are on mast cells, and they function in inflammation. Okay, this is a chart or a line graph showing the comparison between a primary response and a secondary response. On the y-axis, you have plasma antibody concentration. So this is the high, this would be low. This is days after exposure. So you should be able to create this graph and understand how it works. Starting when the first time you get infected with something, so you've never had this bacteria before, you have a very gradual rise in those antibodies. Really, once you're infected with something, it takes about 10 days for you to start to feel sick anyway, but your body's already responding to it. And then from this 10-day to right about there, 17, 18 days, you're fighting off the illness and you're beating it. Really, by this period in here, you've already beaten it, but you're still making more antibodies. And that's because after you've beaten back the bacteria, there's still pieces of it lying around. And so you're still getting activation from those B cells, from those pieces of antigen just lying around. So you're still going to make more. Okay, and then the drop off is gradual, and it's not going to ever really get back to zero. It's going to flatten out after a while. We'll always have those lying around. And this is the first time you've encountered something. But the second time you get it, you already have a bunch of memory cells in your system. And those memory cells already have the antibodies to fight off this bacteria. You already know what it is, you've had it before. So you get a much faster response. Notice the slope of this line is much greater. It's a much faster response, and it's much higher. You get a lot more. And this is why we generally don't get sick once we've had something, or once we've been inoculated for something, because you have this overwhelming response that happens in a very short amount of time. Notice the same amount of time it took you to reach day 10, you're reaching it around day 4. And then where you were beating the disease before, you're reaching around day 5. So it takes a third of the time for you to develop those antibody concentrations. And then the secondary response, notice, stays higher longer, and that's just because of the number of B cells you already have. Okay, so this chart shows how important that helper T cell really is. So helper T cells do become memory T cells. They're stimulated by antigen-presenting cells. They stimulate the cytotoxic T cells and the B cells. Okay, so these helper T cells are so important, and which is why when the HIV virus infects them, our immune system crashes. Okay, naturally acquired active immunity. So these are types of immunity, how we become immune to something. The naturally acquired active just means we got sick. So this is natural. We got sick. So we were infected with something. So we got the bacteria, we went through the whole process and developed our antibodies, developed our memory cells. Naturally acquired passive is mom to fetus or mom to newborn through the breast milk. So mom to fetus through the placenta. It's passive because you don't do anything. The baby doesn't do anything to get those antibodies. Naturally acquired because it's a natural process. Artificially acquired active. The artificially acquired one is when you get vaccinated. So you get vaccinated that with something that's attenuated. Attenuated means it's damaged organism or damaged virus. And or just the antigens. And then it's active because then we still produce our own antibodies. And then artificially acquired passive is when we get injected with IG, say IgGs. So you would do the artificially acquired passive if maybe you were in the military or worked for the government and you were being deployed to an area, say that had malaria, and you don't have time to develop your own immunity through an artificially acquired active. So they just give you the antibodies. Okay, allergic reactions. Type 1 is an immediate reaction. You get hives, or I shouldn't say, these are things like hives, hay fever, asthma, anaphylactic shock. Okay, so these are immediate reactions. Type 2 are antibody-dependent cytotoxic reactions. So they're called antibody-dependent cytotoxic reactions. Take 1 to 3 hours to develop. And these ones would be if, say, during a blood transfusion, you are blood type A, but someone gave you blood type B, and you already have antibodies in your body, in your blood, that are anti-B antibodies. So the type A person would have an allergic reaction. So all that B blood would become agglutinated. Type 3 are immune complex reactions. Okay, they take 1 to 3 hours to develop. And they do cause damage to body tissues. So this one would be if you have, say, a transplant. So someone gets a organ transplanted and your body rejects that. So you're going to have an immune complex reaction. Type 4 is a delayed reaction type allergy. Okay. You usually see type 4 in skin reactions, and it's with repeated exposure to something, repeated exposure to some allergen. So these are often seen with mold allergies, where someone is repeatedly exposed to mold or mildew, and they get inflammation in the skin eruptions, leaky things. And those ones take a while to develop, so along the lines of 48 hours or more. Okay, tissue rejection after transplantation. Remember that we have all of these MHCs, right? Those MHC antigens on our cells. And it's really important that we match as many MHC antigens on our cells to the tissue that we're going to be receiving. These are just some of the things that you can transplant. And there's even more. People are transplanting whole faces, and recently there was a uterine transplantation that didn't take, and the body, they had to remove it, but they did it. Because there's a high chance of rejection because of if these MHCs aren't a perfect match, and they really would only be a perfect match in, say, a twin, but because of that, people take immunosuppressive drugs for the rest of their lives to make sure that the body doesn't reject that tissue. And that leaves you open. If you're suppressing your immune system, it leaves you open to other illnesses. An isograft is a transplant from an identical twin. So someone who's an identical twin, it's called an isograft. Autograft is when you graft something from yourself. So you get, this is usually something like your skin. So maybe you got burned in an accident. They can take skin from a different part of your body, grow it in a lab, and then transplant it onto you. Allograft is from someone in the same species. Okay. Someone in the same species, so another human who donates an organ to you. Xenograft is a different species. And xenografts, for a long time it was popular, and it may still be happening, that humans were getting pig valves, pig heart valves, because they have a similar size and structure, and the MHCs weren't as different as other species. Autoimmunity is just the inability to distinguish self from non-self. So your body all of a sudden decides, hey, this tissue isn't supposed to be here, and it'll attack and kill that tissue. So type 1 diabetes happens that way in the pancreas. Lifespan changes. Just more good news. With the lifespan changes, you get higher risk of infection. So you get a higher risk of infection. You get, don't forget your thymus gland decreases early in life. So you get a fatty thymus gland. IgA and IgG increases. But M and E decrease. So yeah, as we get older, we can't fight off infections as easily. And it's especially hard to fight off new infections that we've never seen before. Effects of diseases in the lymphatic system. Leukemia is a bone marrow disease where you get cancer in the bone marrow. And you get a decreased blood cell count because those blood cells, which are supposed to be making platelets or red blood cells and or white blood cells, are no longer doing that, and instead they're cancerous cells. There's acute versus chronic leukemia. Some people go a very long time with chronic leukemia and are never diagnosed. Treatments include things like chemotherapy, but also replacing a person's bone marrow with a donor bone marrow. So they'll take bone marrow out of a donor and out of their hip bone and inject it into the patient to try to replace their stem cells. Clinical application, AIDS. AIDS is created by the human immunodeficiency virus, so the HIV virus. AIDS, or HIV I should say, infects macrophages and helper T cells. Remember that chart where we saw all the helper T cells do? Later in an infection, HIV can infect cytotoxic T cells. It mutates very quickly, so that's why it's hard for the body to find the HIV and kill it or kill the cells it has infected. And also, it's infecting the cells and destroying the cells that are meant to tell on it. Remember, the helper T cells are just like these tattletale cells. So if it can't, if these cells are being infected, they can't discover the infection and do something about it.